So thank you for coming here to the Breast Cancer Awareness Clinic. Washukuru. So just to start us off with entertainment, we'll be spontaneous. Oh, you're here because of ASK, that is Agricultural Society of Kenya, in partnership with Nairobi Women, Texas Cancer Center, and Faraja, and Safaricom. So karibuni. NHIF.
Hi everyone. Mnaendeleaje? Mna feel aje? Sikuambiwa theme. Ningekuja nijiwakilishe lakini sawa. At least you got us. Sindio? Asanteni sana. How are you guys feeling? Hii baridi kidogo. Mko sawa? Mnajaribu. Okay. First and foremost, it's good to see Texas Cancer Center. Secondly, it's beautiful to see ASK right in front of us. Most importantly, it is beautiful to see everyone's face. Because having 30, 40 people right now, especially because of COVID, is not easy. And so like me, asanteni sana. So here goes nothing. I wrote something, felt the urge to read. I see you, even when the sun doth not shine as bright. I see you, even when you think the rainbows go dark. I feel you behind those masks with a beautiful smile. I feel you when emotions run dry, your face stone cold, your words unfold. I hear you when you pray to let go, when you see your smile fade, when the strength is pale, when you think of your loved one who's suffering from cancer, when you think of the people that you're taking care of currently in the hospitals with cancer, I feel you. So don't be afraid. I say don't be afraid. Call on the system to take charge as we wait. Because the best thing you can do for yourself is be patient. Call on the system to do what's right. Get NHIF to do something wise. Get the doctors to put up the oaths. Get your faith. Don't hide from it. Don't run away. Just accept. 'Cause that's what came. When swelling and thickening, the irritation and dimpling, the redness and scarness, and what of the nipple distortion and the bloody discharge? That's what came when the symptoms seemingly did not show, but the doctor spotted it. How they found their way on this oh so beautiful skin of yours. That's what came. Had you forget your name for a minute? I'm sure when you got the news that you had cancer, you were shocked. I'm sure you asked yourself, am I Steve or am I Steph? I'm sure. Barely at your 50s. But that's what came. You know, here's to the rock and roll of the 1 in 1,000 men and 1 in 8 women who have to wear a different hat, because you see, their hats are already currently renting weariness, because that's what came. Opting for, this is the hardest word to pronounce, mastectomy? Or double mastectomy? I mean, the radiation, the chemotherapy, the hormone treatment, since the wasp dung could not do the trick, tick tock as time contends with death. Because that's what came. When the money bill speaks to your pills, as hopelessness keep catcalling, but the hope of your family keep downing, when vomiting keeps bullying, but your friends and family are so resilient, man, they bring food every single time just to see you keep walking. When chemo and the coexistent depression and anxiety and what the catastrophic personality, what the confusion, what the endlessness. But wait for it, because the acupuncture and the physical activity, some yoga here, some smiles there, some massage here, some sunshine there, some living here. See, life can be a mix of cocktails in this situation. You can have bad days, really bad days, and you can have amazing times. And that's what counts. Because we see you. Do you see me? Do you see me? Because I see you. When your life is left upside down, I see you. With the Nance disease is quite a terrible lover, I see you. When they want the meals for itself, like not even caring about that child who's crying overnight because you know your titties can't help. It's quite a terrible lover, you know? And without quality attention that you need, it opts to take all that time away from you. And it doesn't care that your financial demands are extremely overwhelming. It has you and your family and your friends losing out on their jobs just to take care of you. The Nance disease is quite the toxic lover. Got you weeping in closed doors while smiling in gatherings. Who relates? Yet releasing enough breath to keep you going. It forgets about your suicidal thoughts. The Nance disease is quite a jealous lover. And as though your beauty is not enough, it chooses to have your hair fall out so that you sparkle a bit on that balding. It ravishes and falls for your weaknesses, because in your weaknesses it finds strength. This Nance disease is such a pathetic lover. It knows not heartbreak. It is the heartbreak. I see you. I see you. I see you. I see you and you and you. I see you. Even when the sun doesn't shine enough, I see you. I see you. this struggle is not for long. It's not for long. We still keep hope alive regardless of what staging shows, be it stage 1 or 2 or 3 or 4. We are still alive. Say you're alive. Please say to me you're alive if you believe you're alive. You're alive. We still keep hope alive. Do the self-checks and the mammogram screenings and seek opinions once, twice, thrice. Because we still keep hope that the 5-year survival rate is a possibility. We still keep hope alive. Because suing is a possibility if there's misdiagnosis. We still keep hope alive. Because organizations like Texas Center, like ASK, like NHIF, and the likes, and Faraja Cancer Support are still here for us. We keep hope alive and faith without fear. We keep hope alive. So even when time contends with death, our memories are far from precision of our last breath. We keep hope alive because our lives are memories worth remembering. We keep hope alive. Thank you, guys. Thank you so much for listening. Thank you.
Thank you, Spontaneous, for that wonderful piece. As we wait for our representative for the CEO to read the speech, we can have Hope entertain us with her song, and then we'll proceed. Come, Hope.
My name is Hope Wambui Ochieng from Kibra Langata. I'm 10 years old from Peace Junior School, and my piece today is about cancer. Welcome. Cancer! Cancer! For how long shall we suffer by losing our beloved ones just because you're a silent killer? For how long shall our people lose their beauty just because they can't stand you? Yesterday was cervical, today is breast, tomorrow will be liver, lungs, and so on. No! Enough is enough, because my future is bright. But I'm scared and fear this monster. Mommy, Daddy, my dear friends, my neighbors, doctors, Kenyans, is there hope of ending this merciless beast? Yes, there is hope. Let's stand and fight together. By 1, create awareness. 2, go for early screening. 3, take your young girls for HPV vaccine. To the patients and survivors, you are not alone. We stand with you. We love you. And we salute you. To the fallen heroes, Wangare Maathai, Bob Collymore, MP Ken Okoth, Governor Joyce Laboso, Safiri Salama. Ni hao, uliniwacha mi bila fahamu kuwa ni yako zamu angalau. Ungeniambia eti unakam, nitulize hampungua dhati. Hey, tabasamu zimenikwamia mikononi, labda huu ni mwisho wa dunia. Safiri salama, msalimu Maulana, tutaonana baadaye. Safiri salama, msalimu Maulana, tutaonana baadaye. Ndio, tutaonana baadaye, pendwa, ndio, tutaonana baadaye. Nakam, pendwa, tabasam, tutaonana baadaye. Nakam, pendwa, tabasam, tutaonana baadaye. Thank you.
breasts which are hormonal related.
I think that's clear. They are normal lumps, but they occur occasionally. What happens to the normal lumps is that they are for a season and then they will disappear by themselves. But the breast cancer normals, you see, they'll take time and they are growing. The normal lumps, they will normally reach a certain size and then they'll disappear. These ones for the cancerous cells will continue growing to an extent now that they form what we call skin bursts. The skin can no longer contain them. Now that's when you start seeing wounds and everything. Plus, when they get infections, now they start causing leakage of pus. Pus means that there is an infection and your body is trying to fight the infection. But because these things are growing abnormally, you might find that the body is not able to contain itself. So the abnormal ones, when they are usually followed by other signs. They normally alter the shape of the breast, which is very important now for us to start training ourselves. You should know what is the normal of your breast. How do they look like during each and every stage? The shapes are different at different stages. At puberty, they are different. During pregnancy, they are different. For the mothers who have who are breastfeeding, they are also adopt different shapes. And after now menopause, there's usually a shape for that. So it's each and every stage there is a different shape for it. But now the shape can be different on individuals. So it's important for that individual to know how they are. The other thing that is keen to look at is the size. Size are different, so it's good that you know what is your standard size, so that when you realize that there is an increase in size, you should not count it as a sign that something is happening and go for checkup.
So I have another question. You see, for women, it's very clear and easy to know the changes in size. What about for men?
Sure, it's also very easy. Because, of course, you don't expect men to have very big breasts, although there are those who have them genetically. We call that gynecoblastic, it's a bonded. But again, the shape, especially for the men, the shape is defined. It's almost similar. You get? It's almost similar. But now for the men, what we normally look at is the position. For those who are prone to breathing cancer, you'll find like either one is up more than the other. You'll find them, there is a way they are irregular. There can be one that is lower than the other and everything. That is now the differences that you know. For a normal man, they're supposed to be on the same level. So if you see one is upper than the other, you'll probably know there is something wrong, and that is what calls for investigation. Then again, like I said, the shape is almost standard. So there are those, if you find like their shapes are assuming a different kind of that is not normal, those are the people we recommend to go and have checks. But otherwise, for men, it's a bit hard to do. But we are also encouraging all men to be doing the breast examination. Yeah.
Hi. Does healthy living have anything to do with breast cancer, or you can still eat clean, exercise, and still get it, or? You see how people say,
Yes.
healthy living is important.
Yes, it's important.
And if you eat clean and exercise and do all those things, it's hard for you to get cancer.
Yes,
Does that?
Yes, it puts you at a lower risk of getting cancer.
But you can still get
But you
it.
can still get cancer.
Okay.
Yes.
Like I said, when we're saying the differentiation of cells in the body is normally induced by most of the things that we intake. So even to prevent cancer, healthy living is one of the key things to prevent. Because if you don't have, like I said now, it's only that the differentiation may take place in the breast, but the induction could have happened somewhere else. So, and the exposure is also much. There is those things that expose you to cancer. Maybe when someone should look at that, some of the predisposing factors, one of them is alcohol taking. So, for every other cancer that you're talking about, you'll mention alcohol. So that means sedentary life is also a challenge in that. So healthy living is very important when you're talking about breast cancer, not just for other cancers, but even for breast cancer, it's very important.
One last question from me. So in our family, our parents have this notion that when you use microwaves, it attributes to cancer. Is that true or false?
Not really. Some of these are mates. They are more of mates, but radiation is one of the factors that also predispose you to getting breast cancer and also other forms of cancers.
Is it possible for you, to have breast cancer and not notice? Can the lump really be small, and you don't notice?
Okay, for breast cancer, sometimes you might find there are those who present with no lumps, but they have some lymph nodes that are inflamed on the armpit and some on the neck. So it's not necessary that you have a lump so that you can know you have breast cancer. There are those that present with only a nipple discharge. Also, there are those that present with probably your nipple gets inverted, yani the nipple goes to the inside rather than going to the outside. There is pain, constant pain with no lump. Yes, not really a lump that should be there for you to know you have breast cancer. There are also other signs and symptoms to look out for.
Again, the presentation is usually different in different people. But like for every disease, we normally start with what we call a symptomatic stage. So the moment you start feeling the lump does not mean that is the moment you got breast cancer. That means that you are on the stages. And that's why when you are classifying cancer, we classify it into 4 stages. And people don't normally put the stage 0. The stage 0 is when you have totally no symptoms, you're feeling okay. But that does not mean you don't have cancer. So the time we are coming to experience the lumps is when we are saying it is developing. So for some people, the lump may appear even in the 3rd stage. For others, it may appear even in the 1st stage. So lumps are not, the presence of lumps may signify cancer, but it doesn't mean that their absence means you don't have cancer. That's why now we have other tests, other blood tests that could be done to test cancer apart from the lumps. So when you develop the signs, you're saying you're feeling pain in the breast, but there is no lump. You're seeing mucus discharge, mainly pus or bloody. We also take samples from you and we're able to do tests and ascertain this is breast cancer. And then now we're able to initiate treatment from there.
Okay, mi swali yangu ni kuhusu unajua utapata watu wengi wanasema maybe cancer it's like inheritance, wengine wanasema it's all about food and lifestyle. So saa zingine hatuelewi now which is which. Tunafeel saa zingine tuko stranded, hatujui ukweli uko wapi. Being that mimi mali nimetoka pande ya kina Fadhe, majority yao wamekufa na liver of the cancer. Alafu unapata kuna mtu sahihi akisikia kitu kama hiyo atakwambia ulishaenda ukafanywa test. Unajua sababu being that inakani kama a family thing, so situation yenu pia inaweza kuwa ni kama mko at risk. Yet pia ukiangalia unlike breast na cervical mko zinafanyika free kwa sana, sijui kama hizo za liver ama any other type kunazo zenye mtu anaweza fanywa free. Alafu kuna hiyo pia uko nje watu wanasema, nimejiengage na marafiki wengi wenye ambao wameugua kansa, wengine wamepona, wengine wameenda. Sasa napata kuna watu wanasema chemo ndio inaua, hata si kansa ni chemo. No, which is which? Sababu ukishaambua chemo is the way to go, yet uko nasema hata si kansa inaua, sasa ni chemo yenyewe. Which way forward?
For breast cancer yenye umeuliza kama if in your family kumekuwa na mtu ako na breast cancer, liver cancer, there's what we call genetic factors zenye zina predispose one to getting cancer. If there is family, when you come to hospital, we always ask you, do you have a family history in your family lineup? Do you have a person who's ever had cancer? So genetic factors, they are also a predisposing factor to cancer. So if you've ever had someone in your family who's had cancer, especially breast cancer, it's always wise you go for screening. And also, there is a test you can do called the BRCA test. If you do that test and then they find that there is a genetic mutation of you getting the cancer, you can always use that to go for, probably you can go for yearly checks And also in other developed countries, they're using that, whereby they get young ladies to check if they do the mutation test and they find that in your lineup there is that mutation of the BRCA test, they will advise you after you're done getting children, they'll advise you to go for mastectomy of both your breasts. That lowers the risk. But here in Kenya, probably we can advise ladies who know they have someone in their family who had cancer, or even generally everyone, they should go for screening occasionally. Yeah.
Jambo lingine ningependa kuongeza kwa swali hilo ni kwamba wakati mwingine, wakati tunaangalia ugonjwa wa saratani, tukiangalia familia, ni kweli tunaweza hisi ni kama kwanza unapitishwa kifamilia. Lakini mimi huadvise watu kitu moja, kuna ile the culture. Kuna ile culture yetu, kuna mambo ambayo tunafanya kama familia ambayo yanatuweka at a predisposing factor sisi wote. Kwa hisani yako, pengine umeongea kuhusu liver cancer, and maybe we look at that family, tunaona kwamba watu wengi ambao wanapata hiyo kansa ni wanaume, na tukichunguza zaidi tunaona kwamba kwa hiyo lineage kuna shida na unywaji wa pombe kupindukia. So huenda mtu akasema hii ni ugonjwa wa kifamilia, lakini ni ya kifamilia kwa sababu tabia zile tunapitishana kama familia ndio zinatuweka katika hilo jambo. Na ikiwapo pia kuna mtu mmoja alipata kansa, sasa ukichanganya kwamba sisi tuna hiyo tabia ya kujidispose na kuna genetics pia, tunakuwa na chances higher za kulipata. Kwa hivyo njia moja ambayo tunaweza kusema kansa ni ya kimya ni kuhusu hiyo maisha, hiyo lifestyle ambayo tunaishi. Kama tunakaa maisha ya kurithi ambayo mimi nitafunza watoto wangu tabia kama hiyo, watoto wangu utafunza watoto wao, utaenda tukiishi kusema kwamba ni genetics zetu, lakini ni kitu ambacho tunaweza zuia kwa kubadilisha tu mwelekeo wa maisha na tabia za kimaisha.
Does the wrong bra size contribute towards breast cancer?
The wrong?
Bra size. Wearing a wrong bra or,
No.
Not really.
Not really.
Okay.
Yes. I've heard people saying that plastics also contribute to cancers. I don't know which one. So is that true? Especially when you put hot water in a plastic. Okay, taking water from a hot plastic cup. Is that true?
There is some research ongoing on that, depending on the emission. That's why you are seeing there is a whole lot of discussion about climate change and health, because it is believed that some of the things we burn, when we burn some plastics, they emit some gases into the atmosphere that are attributed to causing mostly lung cancer. And also some small research say that in that water that some chemicals could be absorbed and it could cause colon cancer. But that research is yet to be concluded, and we get a feasible proof that we can link up and say it's a cause. But again, when it comes to plastics, we must understand most of them are made from carbon. And carbon is one of the leading causes of cancer, and that's why you see for those who smoke, they are at higher risk of lung cancer. So that is a research that is ongoing. So conclusive studies are expected to come up and say this is the real story about. But the others now we are treating them as myths.
I have a question. First, thank you very much. I am learning a lot from this forum. As much as I thought I was a guru in cancer, I am glad I came. What advice do you have to caregivers? For example, in my family, there is someone who's been diagnosed with cancer, and I'm the one looking after them. I know you're going to touch about the financial aspect, but you can talk on how does the caregiver manage the cancer patient and also manage themselves.
About management of a cancer patient, one, it drains you emotionally, financially. So when you have a patient, especially as the caregiver, you need also to take care of yourself. One, you need some psychological support. You can choose to go for counseling, probably from where you're getting the treatment. You can also choose to talk to other family members. Also that gives some way of support. Avoid taking the whole burden. Sharing is caring. So try as much as possible to share with your other family members, with your friends, and also with your doctors probably. And for the patient, you also need to get more of psychological support from the hospital where you're going, and probably from other family members. Yeah, it helps a lot when you don't carry the burden all by yourself. You share. Yeah.
I think one of the advices I can say to those now who are caregivers, and probably when you ask us questions, you are basing it for those who are taking care of the patients at home, not in a facility. The number one thing they should try and look out is to understand what to expect. You see, this is something that is changing. A patient is changing day by day. You'd expect to see them going through some situations and all that. When you're expecting that, at least you're able to prepare yourself psychologically. How do I deal with this when it comes? And again, it's always, like she has said, it's not wise for you to close down and say, we will never go back to a hospital, we'll never do this, we just stay with our patient at home and wait till the end. It's important to carry on, to have sessions of maybe even meeting a health personnel or having them come on board and talk to them. Just talk to them. They'll be able to explain you, this is expected, this is not expected, look out for this. And also they'll be able to advise you on things like diet and everything, because it's a whole round thing of us managing the patient both emotionally and physically. The other thing is also about the patients themselves. It's good for the patients now to know that being told that you have cancer is not the end of the light. There is so much that can happen still, and you have a life that there are chances of you surviving. So it's good to undertake those when you are promised treatment and you can afford. It's good to undertake those treatment. And sometimes we encourage also the patients to be talking about what they are feeling, how they are seeing it, because it's helping us also as the specialists, and also to do research and understand why is this happening. Because when they keep silent, we may not know key trends that could help us come up with a solution that could be able to help us in this fight against the breast cancer. So it's important for both the patients and staff to know what do we expect from here, how do we expect progress, and also get advice on every stage, how do we progress. Medically, there is a place we reach in stage 4 where we recommend you for palliative care. For palliative care, I mean that ours is just to reduce the pain and just increase your prolonged life, but there is nothing we can do for the cancer. I think when we be discussing about cost, we'll discuss the stages, how we can treat in these stages, and what the cost implications will be, and I'm sure we'll gain a lot from this. Yeah.
Can we just discuss the stages right now? Because my question was, like the lump size determines the sort of treatment that I get, right? So the smaller the lump, the higher chances I don't need a surgery, right? Okay.
Okay.
What chances of survival? What percentage?
Okay, like now for breast cancer, there is a 45% chance with the proper treatment. There you have to take key that is with treatment. But if this is a person who now just appeared, we are just seeing it's a chance for, the chances are even lower. But with the proper treatment and on good timings, 45% chances of surviving.
45, that's for breast cancer. And the others?
Now there are others that are a bit delicate. Like you talk about liver cancer, that is as low as 20. Lung cancer, 30% and there about. And remember, for you to say that you're in stage 4, there must have been a process of going and evaluation that has been done medically to say that this is stage, because each and every stage is evaluated by it. If I can start by expounding that, normally there is a stage 0 where there are totally no symptoms that are appearing and this person seems okay. Then we will key in on breast cancer here. At stage 1, you may experience now the lumps and occasional pain on the breast, occasional pain, I mean like during your period you feel the pain is intensifying. It's beyond the normal, and then the breast may become even more firm, and that's when now you're able to feel in the lumps. And then the stage 2 now, you start now experiencing now the shape is changing, because now the lumps are growing, the shape of the breast is changing, and in some people the skin texture will change. You start feeling now the nipples are cracking, or they're becoming inverted, or you're feeling like now the affected breast is a bit heavier than the other one, and all these signs you'll keenly notice them especially when showering, because that's when you're able to do. And that's why we recommend examination to happen after showering. I'm hoping we'll be able to demonstrate the process of self-examination here as we go on. So that is for stage 2. Now the stage 2, you start feeling a bit of uncomfortable. Now when you come to stage 3 now, that's when now you start developing sores. The skin become a bit sore. For some people it become like you may have small wounds, and at that stage your nipples might be oozing some pus or some bloody contents in that, and that's now what should call you now to go for a checkup, further checkup and evaluation. The checkup that is at stage 3, you need to go beyond the examination and go do what we call the ultrasound, the imaging. There is the mammogram, there is the ultrasound, or there is an MRI of the breast. When you do that now, and the medical personnel evaluates based on size, he's able to tell you now what to do next. Again, now in the last stage is when now all the symptoms are clear, and now you are starting to affect even the other body systems. You start to get occasional illnesses like COVID. When you have you develop other illnesses as you progress with cancer. So at those various stages, there are different interventions that can be taken, and of course, if you are in the early stages, it's going to be cheaper. Yeah? But if you're in the late stages, now it's going to be more comprehensive. From the stage 1 and 2, we normally recommend a combination of surgery and chemo or radiotherapy where possible. What happens now is that after examining the extent of the growth, you see this cancer is spreading. If it have not spread far, it's only within the breast, we can be able to do mastectomy. We remove the breast and then do a series of chemo to ensure that just in case there were any cells that were remaining that could continue growing, we have eliminated them. Now, when you go to the second stage, we may still consider combining both the chemotherapy, radiotherapy, and chemo. But based now on how far on the immunosuppressibility of the patient, is this patient able to withhold any other side effects of these procedures, we may consider not going to the surgery part or the chemo part. Because now if you are immunosuppressed, meaning that your body is not able to fight the side effects of these procedures, we may not consider that, and we may not put you on now the chemo alone. Because sometimes when you do the surgery and then you put someone on chemo, most people develop other complications. Now, stage 3, we normally don't advocate for surgery, because in stage 3 it means that your cancer is a bit spread, and so surgery will just be igniting it to spread faster. So for that one, we normally put you on radiotherapy if it's far much spread, or chemotherapy. The doctors on assessment will be able to know that this is the case for radiotherapy, this is the case for chemotherapy. Now, stage 4, we can put you on chemotherapy or radiotherapy, but like I said before, there's a stage there's a place we'll come in stage 4 and say this is for palliative care, where we'll only put you to minimize pain and also it from spreading further. But as we wait now for the last stage, and normally that is after we have tried most of the methods and assessment. Maybe you can.
Okay, probably to add on what he said, in cancer, when you're talking about the stages, you basically stage from stage 1, 2, 3, and 4. There's what we call the T&M staging, that is the guideline used by the WHO. We have the tumor size, that is the T, the N meaning the nodes, and M for metastasis. So when a patient comes to you, probably they have this lump that they've had probably for a long time. It's not painful, probably there is the nipple discharge. First, you examine the patient. You get to know there is a lump. You want to investigate this lump. Remember we said not all lumps could be malignant, not all lumps could be cancerous. So you want to investigate whether this lump is cancerous or not. So for you to come up with a diagnosis of cancer, you need to investigate the patient first. One, you need to do imaging. You can start with an ultrasound if the patient is below 40 years. If probably they are above 40 years, you can do a mammogram. Then you need to, after you get the ultrasound results and you confirm true the lump is there, the mammogram will give you whether the lump is there. And the good thing with the mammogram, it will give you something called the BI-RADS. It will be able to give you whether the lump is suspicious for malignancy or not. So once you get the results with all that, you have to get, for you to diagnose cancer, you have to get a tissue sample from the lump. Remember we said not only lumps come to the breast, you can also have swellings on the armpit and also on the neck, the collarbone. So wherever the swelling is, I can see someone checking. Yeah, it's good to check. So when you find out that you have the lump, so we'll send you to get a tissue from wherever the swelling is, whether the armpit, whether the collarbone, or the breast. So once they get a tissue, they'll take it to the lab. That is where you're told, go get a biopsy. So they will analyze the tissue. They will tell us whether it's malignant or not. They will send you back now to the doctor with the results. Once the doctor gets the results, now they will want to stage you. By staging, you have to check the lungs, the liver, all the other organs, whether they are okay. As you did the ultrasound and all that, it will give you the size of the lump or the node that was swelling. That will also help us in staging the patient. So we'll use all those to get the stage of this patient. For example, now, the tumor is only on the breast. It has not gone to the nodes, or it has not gone to any another part of the body. We have stage 1, stage 2, and stage 3. Mostly stage 1, it has not affected the nodes or any other part. It's a lump that is confined to the breast. Stage 2, early stage 2 is also a lump that is confined to the breast. In stage 3, you find there are lumps, and also there is involvement of the nodes on the armpit. It's called the axilla. On the axilla, and late stage 3 is also involving the collarbones, whereby you find now you have a big tumor with involvement of the lymph node on your armpit and also on your collarbone. Also, now we go to stage 4. Stage 4, remember we said TNM, tumor, node, metastasis. What is metastasis? Metastasis is basically if a cancer has moved from one organ to another. For example, you have breast cancer, and the cancer has moved to the lungs, or it has moved to the liver. That is directly stage 4, because there is metastasis. When cancer has advanced and has moved to another organ, direct goes to stage 4. For modalities of treatment, for stage 1 and stage 2 breast cancer, you're treating this patient with the aim of cure, because it is still early breast cancer. You're 100% that you're 95% this patient will get cure. So for this patient, cancer treatment is multidisciplinary. So you send this patient probably to an oncological breast cancer surgeon who will examine the patient. They will advise the patient whether it's good to remove just the lump, or they can remove the whole breast plus the lymph nodes on the axilla, on the armpit. Most of the patients who go for surgery for breast cancer, they have the breast removed and also the nodes on the axilla. Reason is to why, because there is the lymph nodes ndio the transport mechanism kwa mwili yetu. So when they remove these, they are putting you at a low risk of having the cancer move from your breast to another organ. So once they do again they remove the breast, they will take the same sample to the lab again. They will analyze to see whether the margins they cut, they are clear, there are no cells that were left. So they will also analyze the hormones, the estrogen and the progesterone hormones in your sample. That will aid us in the management. So after that, after the surgery, you sent back to your oncologist, who will also again check the histology after the surgery. This will help us in knowing what form of treatment to give you. Mostly you find that in early breast cancer, that is stage 1C and stage 2 to stage 2B, we advocate for chemotherapy post-surgery. Reason as to why we want you to get aggressive treatment is because your aim of treatment is cure, rather than the person who is in stage 4, whose aim of treatment is more of management, is not more of curative, is management. You're trying to give quality to life. Yani you're trying isiendele, but huyu mwingine you're treating with the aim of eradicating the whole of the cancer. So most stage 1, stage 2, stage 3, after surgery, they get chemo, then followed by radiotherapy. Then again, remember we said the hormone receptors. If they are positive, they will be put on long-term treatment, probably for 5 to 10 years, of what you call hormonotherapy. In case there is a patient with a stage 4 disease, this is a person, you don't just tell them that we won't give you treatment, you give them treatment. You can also give palliative chemotherapy to try and lessen the burden of the disease. You can also give radiotherapy, palliative radiotherapy, because you find most of the stage 4 patients there, most of them are in pain. So you can probably radiate to ease the pain. Yeah, I think
One last question. Yes. Can you be declared cured of breast cancer and still get a recurrent breast cancer?
Yes. There are those who get cured. They stay for, like, you hear someone saying, I've stayed for 10 years with breast cancer, but now it has recurred. Remember, we're dealing with cells. Cells are still growing, and they can regrow again. So it's not a guarantee. If you're cured today, doesn't mean you can't get a relapse. Relapses do happen, and they do recur. And probably you find someone saying, I was cured, now it has come back, aggressive, it has moved from where it was to another organ. Yeah.
Especially if the predisposing factors in terms of habit after treatment you never changed, there are higher chances that you'll also get a recurrent.
I've heard this before, that people are saying that chemotherapy and radiology actually are a leading cause towards death, because it's not specifically targeting the cancer cells. It's generally all cells. Is that true?
Chemotherapy in itself has very gross side effects. It is draining. So it's true, chemotherapy targets both the normal and abnormal cells. It's not able to differentiate. Once you give, it's systemic, so it goes into your body. It's not able to select the normal and the abnormal. It hits both. And that's why for patients on chemotherapy, you need to monitor them closely. So every time a patient comes for chemo, you have to check their liver functions, their total blood count, and their kidney functions, just to be sure they are okay. You find that sometimes when they are on chemotherapy, you come to hospital, you're told today you're not getting chemo because your hemoglobin levels are low, so you need transfusion. Those are some of the challenges that the patients go through. So they need close monitoring and evaluation every time they come for chemo or even after chemo.
I have another question. Are there some people who are predisposed for the cancer to spread more than others or faster? Because you've had in some cases, someone goes for a test, like the ones you mentioned, for a biopsy, then by the time they go back, it has moved from stage 2 to stage 3. Or what happens in a typical African situation? If someone is told they have cancer, You first call a family meeting, I have cancer, then you want to seek consultation, another doctor, then by the time you're going back, maybe you're in stage 4. So what can we do to make sure that when you're seeking treatment, it goes faster? Then a second question, how come there is no vaccine for cancer? COVID came in less than 3 years ago, and we have a vaccine, but cancer has been here forever.
I can say delayed one of the factors that is making us get patients who are in advanced stages of cancer is, as you said, once I'm told I have a lump, I go to hospital, I'm told I have cancer, I want to go tell a family member. The family decides to call a meeting. They say, no, that doctor was wrong. They go to a second doctor, says I have cancer. They say he was wrong. Goes to another one. By the time you're jumping and hopping from one doctor to another, remember you're dealing with cells that are growing, and they don't know to wait for your family to make a decision to go to this doctor who will finally say you have cancer. So delayed, the moment if you're told you have cancer today and probably it's in stage 2, it's important to start treatment immediately. If you start treatment immediately, you are at a higher chance of not getting a metastasis because you've already saved it early. Early detection will save it from advancing. Yeah.
As per your question for the vaccine, I can confirm there is a vaccine for some cancers. The most common one is HPV. It's called Cervarix for cervical cancer. So there are some vaccines. But again, when it comes to vaccines, developing a vaccine is a long and tedious process that requires a lot of studies and everything. And cancer being unlike COVID, which is, we know it's targeting only one system. We know it was the respiratory system. It was easier to develop a vaccine for COVID than for cancer, because you see cancer is varied. There is lung cancer and everything. So we may not have a standard vaccine to say that this is a vaccine against all cancers. We may have so many that you'll find yourself, you have like 20 vaccines that you're supposed to take, and you're like, how? You get. So, but there have been studies, there have been researches being ongoing to see whether we can have a developed one. For example, I can also take for the example of the HIV. So there is no vaccine for HIV, but there are other methods that have been developed for us to protect ourselves against cancer. So a lot of effort is being put into the research on cancer, and probably in future we may have a vaccine also.
There's the aspect of, psychology and mentally getting that news that you've got cancer. How do your individual organizations help one to deal with, such news?
I will talk on basis in regards to Texas. We at Texas have we have a method whereby if the patient comes in, they know they have probably they have cancer. You don't break the news. You don't just tell the patient you have cancer. No. We have a counselor. We also involve our counselors. They first go through counseling. Then they are called in with the family. The news is told to the family, and then they're advised on what is the plan of management. Probably if you refer the patient for surgery, if the patient is supposed to start chemotherapy or radiotherapy. We involve counselors who help us mostly in dealing with our patients, and also our doctors are trained on that, on how to deal with breaking news and the patients.
On our end, we engage in what we call pre- and post-test counseling, whereby we involve before we do the test, we involve on the patients what to expect and how to deal with what is expected. And again, after now we do the test and you have confirmed whether positive or negative, we still take you through the counseling and tell you this is now what you are negative, you need to stay negative, this is what you're supposed to do, this is a lifestyle you're supposed to adopt and everything. In the event you are positive, we now be able to take you through what to expect, and we give you options you want to choose. Like now, if you say there is an option of radiotherapy or chemotherapy, we're able to take you through and show you the side effects on your health and all that, and then you're able to discuss from there. But at every stage of treatment, we involve counselors so that they can prepare you psychologically what to expect. And our doctors are also well advised. They'll give us the update that this is what we expect. So the patient stays mentally knowing that this is the worst that could come or this is the best that could happen, and they're able to make the informed choice. With that informed choice, whatever the outcome, you find that the patient is going to be more mentally resilient to handle the outcomes. And in the event something else happens, they'll still be able to know, I was told there are chances of anything else that could happen. You have a
Excuse
question?
me. What can one do to prevent the relapse?
The relapse of?
Cancer.
The recurrence.
Yes. What can one do to prevent that?
After the treatment, there will be set of guidelines that will be given for you to stay out of cancer. And on that, it will be the lifestyle choice. What are some of the things that you need to stop doing? What are some of the habits that you have to drop? And some of the habits that you need to adopt? And of course, the key habit that happens there is nutrition. What is safe and what is not safe. So those are some of the things that you'll be taken through. And it's always wise based on the individual, because there are things that will be given to the individual that after now the treatment, you have a sitting with the oncologist and they give you an advice. Plus, after that now, we recommend you also be doing regular checkups to be knowing how you are progressing on the same.
Post-treatment, we usually put patients on reviews. After treatment, we see you after 1 month, then we follow up 3 months until we are sure. We give you 6 months, then 1 year. We always advise you to be coming for checkups. In case there are any issues that could be cropping, we can be able to detect them early and take action. Yeah.
Thank you. There was a question that came that once you found out that you've got cancer, then and you do not have money, where do we start? For example, if I came to Nairobi Women's, will NHIF cater for anything? What particularly, for the low-income earners, what is the solutions therein?
At the moment, I know there are so many charitable organizations that are working to help patients with cancer. I've seen Safaricom Foundation doing something, but I may not speak much. On part of NHIF, they have really done much to support in the fight against cancer. One, I've seen them support installation of key equipment in some hospitals in some rural areas. I've seen them help hospitals secure public funds to do the awareness and all that. But key to mention that in their financial programs and the cancer and the packages that we have, they have included a specific oncology package. The oncology package is to specifically take care of chemotherapy and radiotherapy sessions. And it depends with the facilities. Like in a government facility, they might sponsor up to 3 or 4 sessions in a week. But now, because the cost is different for private facilities, it will depend on the facility that you have gone. So what you need for that is just to have a valid NHIF card and go to them with valid results and tests that have ascertained that you have cancer and the recommendation of the doctor of what you want to do. And they are very good because they have partnered with KMPDU to make sure that they have the list of all certified doctors, both locally and outside the country, so that you don't go to those who just want to put you on everything. Plus, they also do their due diligence to ensure that exactly what you are diagnosed with is the correct. So when they do that now, they're able to approve you to go for the sessions, and they pay fully for the sessions. So they have really done much. They have really helped us. Again, at least now we know there are people. And this happens to both people who are on self-employed cover and those who have covers for others. We also have other insurances that have taken up the cancer markers, and you're able to now pay premiums, litro by litro, and with time, you're able to access the treatment covers. And also, as hospitals, we have done subsidized prices for some of those procedures, so that we are able to cater for even the common person who is not able to cater for the full procedure. Another part on surgeries, the NHF are funding for surgeries up to a high of as much as paying, even to have it, I remember of a case where they paid more than $500,000 for a person to go through a surgery related to cancer in our facilities. So they are doing a very good job in that, and they are helping a lot in the fight against cancers.
Yeah, we also accept NHIF cover, both for civil servant and self. It pays for radiotherapy up to 20 sessions, and also for chemotherapy. We have basic chemotherapy and we have basic and complex. So for basic, it pays up to 6 cycles. For complex, it pays up to 4 cycles. Yeah. So it has really helped patients. And also we've come up with a way for those patients who don't have NHIF. We encourage them to get the cover. And also we have subsidized our prices to be able to help those patients, despite that the NHIF cover is covered and sometimes the treatment is expensive, so that they can be able also to pay for the treatment. Yeah.
Yeah, I'd like to also to ask about the predisposing factors, because we know prevention is better than cure. So do you have major things that we should stop doing so that we avoid getting the cancer? Thank you.
Lifestyle, as we talked about, cigarette smoking, alcohol intake. For women, we can say use of contraceptives. Most of these contraceptives are hormonal and they affect our hormones. There is also things like obesity. You need to keep fit. Yeah, those are the main predisposing factors. Also your eating habits. Look out what you eat. Yeah, garbage in, garbage out.
Now, one interesting predisposing factor for the breast cancer is one. Breastfeeding helps avoid breast cancer. So we normally advise people that when you can breastfeed, breastfeed. If you're able to breastfeed for a child up to a maximum age of 1.5 years to 2 years, you are reducing your chances of getting breast cancer by a far, far higher margin. Yeah.
Also, if you're able to get children before you clock 35, it puts you at a lower risk of getting breast cancer, ovarian cancer, and cervical cancer.
For Texas, I saw somewhere, I think something Uwezo, I think cancer support. Is it for assisting, the patients financially, or what is it? And if it is for assisting patients financially, what is the procedure that one needs to take?
Uwezo is not for supporting patients who are on treatment. It is a group of ladies who have finished treatment. Actually, they are survivors. Most of them got their treatment in 2010, 2011, up to 2016. They are survivors of more up to 5 years. They come together. They formed a support group. They meet every month. They try and encourage other patients who are on treatment. They also do awareness back in their homes, and they are also doing they have some activities that they are doing that are helping them generate income. Yeah.
That's actually a good initiative. At least a support group is something good. But maybe I think it's a proposal. The same way you culture Uwezo cancer support, maybe it could be a way where also as a cancer center, you can customize. There are people that are ready to help. The nation is ready to help in this fight against cancer, to assist the less fortunate. So maybe you can consider having a support group where the nation is involved, the citizens are involved, and we are able to support those not fortunate enough to afford cancer treatments.
For the patients who are not able to afford treatment, we don't turn them away. We come up with a way of a subsidized rate for those patients so that they are able to get their treatment. And also, we find that probably they have NHIF, but it's not able to cover everything. We can make them pay for the card covers up to a certain amount. Then the other amount probably we as a hospital decide after doing we analyze, we see whether this patient really is needy. We are able to help out. Yeah, but anytime we get people who want to sponsor patients, we don't turn them away. They are most welcome. We can always pinpoint the patients who really need help, and they can be helped. Yeah, we have people who come to sponsor patients, yeah, and they are always welcome.
Thank you so much. Is there any other question? Any other pending last words you want to tell us?
It is a good initiative. Thank you for the invite. We as Texas Fraternity, we are grateful. We're hoping to working with you in the future. It's good to create awareness because early detection saves lives. Yes. If we create awareness to our community, people will go for screening, they will get treatment early, and that will prevent deaths in the future, and we'll be able to fight cancer. Once again, thank you very much for the invite.
Thank you so much, ASK. Thank you for organizing for such a wonderful event. We are really honored to be here, and we are glad that we are able to reach out to communities and be able to educate them on cancer. And we are looking forward to having even many more on this side. And I wish maybe when you'll be doing the International Trade Fair, maybe you could add a theme that we could come up and that, because I know at that time there will be masses people flowing here, so that we could educate people about this and many more cancers. And we really appreciate for the opportunity. Thank you.
Thank you too. That's a very good idea. I think we'll plan on our side, discuss with management, and consider it, because I know there are some people who are not brave enough to just come here and get checked. And that will be maybe an opportunity to explain to them that, knowing your status is better than shying off. Yeah, thank you.
Once again, from our end, we just want to thank you for being here and, for helping people get to know, to examine their breast cancer awareness or their status, not awareness, their status. So I want to pass apologies from our CEO and the national chairman. They couldn't make it to the forum, but he sent a representative to read the remarks that he was, for the national chairman, so that she can read the remarks the national chairman was supposed to make. So I want to welcome Priscilla Kamau, who will be reading the remarks for you.
Thank you. My name is Priscilla Muia. Yes. Yes, I see it. Oh, no problem. Okay, so invited guests and our visitors present, members of the Agricultural Society of Kenya, distinguished ladies and gentlemen. Okay. Yeah. Okay. Invited guests and visitors present, members of Agricultural Society of Kenya, distinguished ladies and gentlemen, good afternoon. It's with great pleasure that I wish to welcome you all to the free breast cancer awareness clinic and cancer financing initiative. Thank you for being here with us and for the participation and support accorded towards the cause, Breast Cancer Awareness Month. The Breast Cancer Awareness Month is an opportunity to shine a light on breast cancer and keep it high on the public agenda. It also allows us to shed light on the challenges and often invisible realities of living with this disease. As part of our corporate social responsibility,
The society is committed to making a positive contribution to the surrounding communities. The society recognizes the importance of embracing the National Breast Cancer Awareness October month, dubbed an Indigenous Pink Day globally. We recognize the value of all women and men accessing education on breast cancer and screening opportunities for early detection and intervention. Community health remains vital in the development of our economy. I would like to thank all partners involved in the Agricultural Society of Kenya's Breast Cancer Awareness and Financing Initiative campaign for the invaluable work done and for sponsoring this campaign event. In detail, we would like to thank our noble sponsors for this campaign. Number 1, Safaricom Limited. Number 2, National Hospital Insurance Fund. Number 3, Nairobi Women's Hospital. Number 4, Farancha Cancer Support and Texas Cancer Center. 2020 and 2021 has been too challenging year for us all. We believe it has been particularly difficult for cancer patients and their families. The COVID-19 pandemic disrupted cancer treatment, delayed screening, and affected access to medicines. The society, through this course, is on a mission to change a life or lives. We hope that with your support, this free initiative will be beneficial to a patient or patients in need of breast cancer treatment and care. We urge you to consistently seek advice and screening in order to detect breast cancer at the earliest stage possible, starting today. The society looks forward to working with our partners and stakeholders to make this an annual initiative with a difference to the breast cancer patients nationally. Together, we are a powerful force for change. Together, we can strive for more. Together, we can make a difference. Thank you. Okay, thank you very much for being with us. We really appreciate. Thank you.
So thank you, everybody. It's a wrap. We live at your own pleasure.